Now, most people think that it is just the diet that determines whether or not you develop hemorrhoids. So they think that if I have a lot of spicy food or if I have a lot of coffee, then I will have hemorrhoids. But it isn't just your diet. Just as important your diet is, or probably even more important, is the way you pass stools. The way you pass stools, what I mean by that is that do you apply pressure or no? So one thing you need to keep in mind when you're passing stools, and one thing I constantly tell my patients, is that please do not strain. Whether you remember any advice that I have told you so far, or if you choose to forget everything, but if you can retain only one single point from this entire video, then the one thing you should remember is that you must not strain. I am Dr. Shreedevi K N. I am a consultant surgical gastroenterologist working in Bangalore in Chirag Global Hospital. So ultimately, how can one prevent hemorrhoids? So as mentioned previously, hemorrhoids is not as a result of one single cause. It happens due to a combination of multiple factors. So this includes your diet, your water intake, the amount of exercise you get, the amount of stress you're under, and also your bowel habits. So I'm going to talk about each one of them a little bit so you know what you are doing wrong or what you can simply change in order to make sure that you don't develop hemorrhoids or any problems because of it. So first of all, diet. As a broad rule, it is good to always have some fiber in your diet, because when you have fiber in your diet, it draws water into your stools and makes sure that that is soft. So when you have a free soft passage of stools, then it will not cause any increased pressure in your anal area, and that will prevent hemorrhoids. So when it comes to diet, what you must do is you must make sure that you have some fiber in your diet, like a good amount of raw fruits, vegetables and green leafy vegetables, and make sure you have enough water intake. What you should not do is you should not have simple carbs which are digested very easily. So if you are somebody who is having a lot of simple carbohydrates, then these get absorbed completely and there is no waste generated. The human stools is nothing but the waste or the roughage, the fiber that we cannot digest it, which is thrown out into the stools. So if we are having only simple carbohydrates which does not generate any waste, then you will not have enough stool bulk and you will struggle to remove that stools from your body. The second thing is exercise. If you have a very sedentary lifestyle where you are sitting for over 8 to 9 hours in a day and you have no physical activity, then definitely you will have some problem with constipation. So to put it very simply, unless you are moving, your intestine will not move. That is why we suggest that everybody should get at least 30 minutes of exercise. It can be something as simple as a walk, or it can be something such as standing exercises or proper cardio exercises such as swimming or running. But the least you can do is 30 minutes of walk every day to make sure that your intestine keeps moving, and so do you. So the third most important thing, or probably the most important factor in this entire list, is your bowel habits. Now most people think that it is just the diet that determines whether or not you develop hemorrhoids. So they think that if I have a lot of spicy food or if I have a lot of coffee, then I will have hemorrhoids. But it isn't just your diet. Just as important your diet is, or probably even more important, is the way you pass stools. The way you pass stools, what I mean by that is that do you apply pressure or no? So one thing you need to keep in mind when you're passing stools, and one thing I constantly tell my patients, is that please do not strain. Whether you remember any advice that I have told you so far, or if you choose to forget everything, but if you can retain only one single point from this entire video, then the one thing you should remember is that you must not strain. So each patient has a unique bowel habit. Some people pass stools once or twice in a single day, and some people may pass stools once or twice in a week. So this is normal depending on your body. And this again depends on your diet, your exercise and your bowel. So do not stress about not having passed stools. Most people think that unless I push the stools out, I will not have a comfortable day. and that is extremely wrong. So you have to wait for the urge, okay? You have to wait for the urgent feeling where your body tells you that you must go and pass stools right now. So when you do get that feeling, all you need to do is go and sit on your toilet, whether it is a Western toilet or whether it is an Indian toilet. You just need to make sure that you have to go and sit only when you get the proper urge. So when you do, your bowel will push the stools out. So unless you are somebody who has some sort of neurological problem or a slow motility issue where your intestine cannot pump the stools out, majority of the patients have no such underlying problems, and all they need to do is just make sure that the time they go to the toilet matches the time that they get the urge to pass the stools. If that is something you can do, then you don't need to do anything else to prevent hemorrhoids. So whatever food you eat or however hard your stools are, if you make sure that you are not applying pressure, no matter the type of stools, then you will not have a problem with hemorrhoids. Apart from this, the general rules that you have to follow is adequate water intake, avoid toxic substances, avoid drinking and smoking, and make sure that you have an overall health. Make sure that you try to aim for overall health and not just for reducing or preventing hemorrhoids. So when it comes to preventing hemorrhoids, there are certain things that you must not do as well. So I'll break it down for you. I'll talk about what you must not do when it comes to your diet, what you mustn't do when it comes to your exercise, and what you must not do when it comes to your bowel habits. So when it comes to your diet, I would advise that you should eat like your grandparents. I think that is the simplest way in which I can put it, because what they used to follow is something each and every one of us should aim to follow. They eat locally or organically produced foods. They used to avoid a lot of food that has been processed or preserved, and more than 90% of the time they used to eat home cooked fresh meals. So this is something I think everyone must follow. So what you must not do is that you must not follow these fad diets very blindly. So you must have heard of a lot of diets. There is a keto, there is an Atkins, there is a blue zone, and there are all these diets. I believe that if a diet is named, then you definitely should not follow it. You should just follow whatever diet that you have normally at your house, whichever place you are from, whatever food your body is accustomed to. I think you should follow that diet, unless of course you have specific allergies where you have to avoid certain foods, then you must. But otherwise, as a very broad and general principle, I would say each person should simply eat as well and as richly as their grandparents did.